Hello everyone. Have you ever wondered the differences between a counselor, therapist, psychologist, and psychiatrist? Are they basically the same thing? Can they prescribe medication? Who has the highest education? And most importantly, who should you seek help in times of struggling? In today's video, I'm going to break this down clearly and simply. So by the end, you will know exactly who does what and where to seek help. Let's now start with counselors. A counselor typically holds a master's degree in counseling psychology or related field. Their training focuses on talk therapy, helping people with various challenges, including but not limited to managing stress, anxiety, depression, trauma, relationship challenges, as well as life transitions. In Canada, most counselors are registered under provincial or national professional organizations such as BCACC or CCPA. Counselors are able to provide psychotherapy, teach coping strategies, work with emotional and relational concerns. However, they are not able to prescribe medications or provide any formal diagnosis to the client. They are oftentimes the most accessible and affordable mental health professionals. Now here's what's really confusing. Therapist is actually a broad umbrella term. It describes what someone does, providing therapy, not necessarily their level of education or qualification. A therapist could be a counselor, a clinical social worker, a marriage and family therapist, or even a psychologist. So when someone says they are a therapist, it is very important for us to ask, what degree do they have? Are they registered? What regulatory body oversees them? The word therapist alone doesn't tell you about their exact qualifications or educational background. Next, we are moving on to psychologist. Psychologists usually have a doctor's degree, usually a PhD in psychology, and they are regulated by provincial colleges. Psychologists are able to provide psychotherapy, conduct psychological assessment, diagnose mental health disorders, conduct formal testing for ADHD, learning disorders, personality structure, etc. However, they are not able to prescribe medication in most of Canada. If you need formal psychological testing or complex diagnostic clarification, a psychologist is often the most appropriate referral. And finally, we have psychiatrist. Psychiatrists are medical doctors. They complete medical school and then specialize in psychiatry. In Canada, many complete years of extensive training at medical schools. Psychiatrists can diagnose mental health disorders, can prescribe medication, they can manage complex mental health conditions, and sometimes they do provide psychotherapy. However, they often place a greater focus on medical intervention and medical management. So if someone has severe depression, bipolar disorder, or needs medication evaluation, a psychiatrist is typically involved. Now that we have talked about the differences between these professionals, so how to choose who to seek help from among all these professionals? If you are unsure who to see, Start with a counselor for general emotional support. See a psychologist for assessment for diagnostic clarification. See a psychiatrist if medication might be needed. And remember, sometimes professionals also collaborate. So I hope this video helped clarify the differences. If you find this resource to be useful, like and subscribe for more mental health educational content. And if you have any questions, drop them down below in the comments. Thank you.